For our first talk in this session, I'd like to introduce Peter Song, who's a professor of biostatistics, and his research is in bioinformatics, longitudinal data analysis, missing data problems, and statistical genetics and time series analysis. He does a lot of work that's motivated by real-world data analysis, which I think strongly informs the work that he's going to be talking about today. And so with that, I will pass it over to Peter Song.
Good morning, everyone, and thanks for the invitation. So I would like to present some of my personal reflection of the role of biostatistics and health data science has played to fight against the unprecedented pandemic in the past year or so. So who would believe that it has been 1.5 years already since the first COVID-19 case report in China in December 2019. 1 year later, FDA approved the emergency use authorization for Pfizer mRNA vaccine on December 11th, 2020, which really light hope to the end of the pandemic. As shown in this timeline of the major events over the period of 1 year, as shown in this timeline of the major events over the period of 1 year trying time, so many episodes has happened. So when we look this pandemic retrospectively, what statistic contribution has are most impactful to help fighting against the pandemic? Among many contributions, these three, in my view, are highest impact. Data visualization helps turn different boring numbers into intuitive, easy to understand figures for the public to see the temporal and spatial patterns of infection, death, PPE, and vaccination progress. And prediction is another important contribution, and statistical prediction model helps foresee possible paths for future evolution of the pandemic with and without control measures and vaccination. Evaluation certainly is another major contribution from statistical science. Statistical principles and method help evaluate efficacy of interventions such as social distancing, masking, and vaccination. So what about the incompetence? There are several areas I think that our statistics are not doing very well. Inadequate infrastructure to collect high quality public health surveillance data and mobility data, given the nature of the infectious disease, and the control measure or the efficacy control measure has to be aligned with the mobility analysis, and lack of effective filters to identify, verify, and triage misinformation and alternative facts, which had a lot of impact on the public to understand and to incorporate, to have unselfish decisions be part of this fight against the pandemic. And I think that insufficient serologic survey to evaluate herd immunity is another area of the sort of incompetent that we should do a lot better. And shortage of effort on systematic influence on policymaking, from statistical modeling analysis to actually direct influence on policymaking is another, I think, the area that statisticians did not do very well. Let's talk about a little bit more about the role of data visualization. You can say that data visualization is a very effective way to communicate data and statistics with people, particularly for people who have very minimal knowledge of statistics. You can see the two figures on the right that gives very intuitive and easy to understand sort of figures to see the trend of the current status of vaccination or infections. it's very intuitive to monitor temporal trajectories and spatial patterns, infection, deaths, and PPE and vaccination. This data visualization provides essential information on happenings in the past and reflection of policy retrospectively. Unfortunately, those figures do not provide projection on what's going to happen in in the future time. So we are very proud of many innovative contributions to the development of prediction models in the statistics community. This is a much needed work in the early stage of outbreak when data are sparse for people to understand the how this flattening the curve could happen by which control measure. Okay. So this prediction model helps evaluate impact of control measure and the government policy on the future trajectory of pandemic. Okay, so a prediction is essential to tell the public what's going to happen, what effort we should make in order to control the spread of the disease. So another important area of this prediction work is to help evaluate efficacy of vaccination on the control of pandemic. If we have 50% of vaccination in the population, if we have 70% of vaccination in the population, what's going to happen? And how soon that this pandemic can be controlled so people can return to work and so on and so forth. So prediction is very essential in the infectious disease modeling. So let me just mention two important classes of prediction model that have shown great power on the pandemic prediction. The first one is the very classic multi-compartment infectious disease model. This is a well-known temporal model useful to capture basic dynamics infection in the early stage of pandemic when surveillance data are still sparse. It helps estimate the severity of the initial transmission rate and project the evolution of the infection with no control measures. So if we do not do anything, what we'll face in the next few months or so. Very important model to be applied in the early stage of the outbreak of the disease to understand what's going to happen in the it also helps evaluate impact of early intervention to contain the infection and estimate possible turning points. So that statistical model will help us to really learn the dynamics and try to project what's going to happen. Okay. The other class of prediction model is von Neumann's serial automata infection disease model. In my view, this is very powerful spatial modeling useful to capture infection dynamics among spatial locations in the interesting interacting system. Okay, this system relates to more complex spatial connections than a typical geographic locations due to various ways of human migration or travel. If you think about the distance between Detroit and Seattle, which is, in the modern, sort of the transportation system, the distance between Detroit and Seattle is very short. It's just 4 hours by flight. In comparison, the geographic location of Columbus and Detroit, maybe the distance between Seattle and Detroit is shorter than the distance between Detroit and Columbus, Ohio, because of this modern transportation system. So the classical spatial modeling may not be that effective, but using the serial automata, spatial modeling can help us to have a more realistic way to model the infection of across spatial locations. So a basics, such model utilize spatially heterogeneous phases of infection and control measures for better prediction of pandemic over locations. It also allows for evaluate pros and cons of state-specific or country-specific control measures within the same system of infection where locations are connected rather than being isolated. Okay. Interestingly, this particularly appealing to study pandemic as global health, public health crisis. The world is connected, spatially. Okay, thinking about the infections coming from Europe, from China. Okay, and now we're facing this the new surge of the infection from India. So the world is connected. How do you use this spatial modeling? To evaluate the possible infection in the next few months or so. So let me turn to this vaccine trials. Clinical trials are new on new vaccines can only be done under the guidelines of rigorous community-level clinical experiment design. We should all thank to the great effort by statisticians over many years who have developed mature and well-justified theory, method, and software to make such experiment design possible in a super speedy manner. I would like to point out that this fundamental contribution by statistical science has been largely oversighted in the media as opposed to the praise of innovation, the mRNA vaccines. This is a rigorous experiment design that made the delivery of vaccines to public a big success. Okay. So now let us talk about some of incompetence. First, I would like to discuss the issue of efficacy of face masking. With no doubt, effectiveness of masking appears and remains controversial, and mixed message has been sent to the public over time. Such controversial is obviously attributed to lack of rigorous clinical trials on face masking. This trial is near impossible to conduct in reality. Realistically, evaluating efficacy of masking requires means of causal inference in observational study. For this theory, method, and software are not yet sufficiently mature to draw convincing conclusions, besides various issues of surveillance data quality. So it's worth mentioning about the pandemic of misinformation or alternative fact as being disturbing and created noticeable negative impacts on well-beings. Health data science has not been very effective to handle this misinformation pandemic. There's a clear need of health data science method to identify and verify and triage misinformation. So another area that needs a big improvement is the influence on policymaking. Speedy dissemination in research finding to public health is of most important. Over time, I have strongly advocated transparency of toolboxes developed for the study of pandemic, in particular the prediction of evolution of pandemic. So my lab is the only research unit that released the software for prediction, which is we need certainly establish open sources of statistical models and software so statisticians can compare different models and methods. Unfortunately, that our software, it's only software available. Several methods claim to make an excellent prediction of infection were unavailable for comparison. We need better communication skill to get more effective public sort of interviews to deliver statistical result too. So also we need to learn how to disseminate our results, for example, through YouTube and stuff like that. So I know there are a few questions, but I like to answer questions at the very end. Okay. So to close out my talk, I would like to comment on some of training components on our biostatistics curriculum. We need to increase the substantially the coverage data visualization in intra-statistic courses. So intrastat courses are dominated by number calculations rather than by graphic display of data. We need to improve that for sure. Also, we need to offer a course on spatial temporal models on a regular basis with application in infectious disease modeling. I will teach actually this fall semester a course in infectious disease modeling as the first step of this effort in the Department of Biostatistics. Also, we need a topic community clinical trial in the existing course of clinical trials. So we do have a course in the Department of Statistics of clinical trials, but I think that adding a topic in community clinical trial is important. So which will basically deal with these vaccine trials. We should strengthen methodology research, upgrade education material on causal inference in observational study. Control measures policy issued by government can only be evaluated for their effectiveness in the context observational study. This is there's a clear need in the methodology research of causal inference observational study. That's all I like to say today. Thank you for attention.
Great, thank you. If anyone has questions, we have 3 minutes, so maybe while we're switching, presenters, we can do a quick question or two. If there's not open questions, I was curious, Peter, if you could talk a little bit. I definitely agree about the point. I mean, many of your points, but this point about sort of speed being important for being able to be relevant to policymakers. And as academics, I think that's often a challenge. I'm curious if you can talk a little bit about how you think about balancing speed and rigor when it comes to doing this kind of work.
Right. I think that if we have available system to compare different prediction models, and the spring last year, we have our prediction model sort of developed, and we really want to compare with the models that people claim that are really the best and that are used by White House to guide the prediction. And at that point, I really want to compare our prediction with their prediction. I mean, if there's such a system that will be really, give some kind of speedy, rigorous sort of evaluation, the quality of our method versus other methods. But later, because of the availability of our model and software in a publicly available database, then over 20 countries, they use our model and our software to prediction the infection in their countries. But my question here is, maybe there are better methods than ours to predict their evolution of their infection in their countries. But those models are not available. They claim they're the best in the world, but we will see how that can be best. I mean, we would like to really make comparison, but their methods are not available in public domain. There are like in some publication, they have this just one paragraph describing what they're doing, what type of model they have. They just don't have software. I need their software. I don't care what you said. I really need your software. We can directly have head-to-head comparison of the prediction accuracy. So we can really identify which one is better, which one is more effective to give better information to the public, right? So I think that's something is lacking. I think that I complain a lot about this in the past year.
No, I think that's a great point.